One of the questions people often ask is, why do we need fluoride in Bennington? And to us in the dental profession, it's rather obvious that Bennington has one of the highest dental needs in the state. Last year in 2013, the health department did a survey of a select number of schools. At random, they picked certain schools and they picked certain grades and did screenings on kindergarten and third graders, and then did a comparison of the schools. Bennington had, or Bennington area, I'll say, because at that the statistics actually included Shasbury, but we had the 3 out of 4 highest rates of decay experience, which means having a cavity, and also the unmet need, cavities that were not treated, were not fixed. That means active decay lesions in children's mouths. We had 3 out of 4 of the highest rates. 2 of our schools, which are the Bennington schools, had 21% and 23% of kids with cavities that the cavities weren't taken care of. We also had 58% and 53% of the number of cavities that the school children had. In comparison, a fluoridated town such as Middlebury had 7% unmet need on attended lesions. Another fluoridated community, Shelburne, had 3.5%. So you can see a significant difference in the fluoridated schools, or the schools in fluoridated communities, and the schools in non-fluoridated communities. Now, children, even though it may seem, oh, only 23%, that is 1 out of every 4 children examined had cavities that needed to be fixed. No child should have cavities that are not tended to. Cavities are disease. So that's 1 out of every 4 had disease, had dental disease. So the need is obvious. Bennington is also, throughout the state, uses the highest amounts of Medicaid for dental and for dental extractions. Dental extractions are done only when there's nothing else to do to save the teeth. Through Medicaid, I don't have exactly the figures, but I can get them for you, of how much money per year is spent extracting teeth in Bennington through Medicaid. So that's just one of the reasons. The other thing is, you may have noticed that we have wonderful dentists in town, but we still have lots of people who cannot get into a dentist, who can't get dental problems taken care of. So it's a great need here in Bennington for something to be done, and water fluoridation, community water fluoridation, is the basis for all improvements in dental care. I'll turn it over to Wes.
Okay.